Cancer researchers at Gundersen-Health-System in La Crosse are using their expertise to help local officials understand COVID-19.
Yeah, their efforts are identifying where a specific case came from and how it spreads. News 8 Now's Jordan Fremstead explains how this research can help keep our communities safe.
It's really shaking up what we do on a day-to-day basis.
His experience is in cancer research. Like the rest of us, Dr. Porat Kenny of Gundersen-Health-System had to embrace change.
We still have 4 or 5 people doing full-time cancer research all the time, but we've taken a couple of PhD level researchers and put them directly on working on COVID-19.
His research normally provides hope to those with complicated cancers, but that hope has transitioned to communities dealing with COVID-19.
We were the 15th institution around the country to bring this online.
It's called genome sequencing.
29,903 letters long.
Kenny says the COVID-19 virus genome is made up of letters. Those letters are instructions on how to make the virus. The virus copies itself in one infected person before it infects someone else, but sometimes the virus makes mistakes with those letters. Those spelling errors are useful to researchers tracking the virus.
It allows us to build up family trees of this virus so we can really track in pretty fine detail the transmission chains of this virus.
Allamakee-County is an example of why research like this is so important.
One introduction to our region, which we know came from the New York area, but it is now spread out to 16 cases that we've been able to sequence here at Gundersen.
When the virus unknowingly spreads, health officials are powerless to stop it.
The fear is in a situation like this, you're really looking at the tip of an iceberg.
Gundersen has sequenced more than 50 virus genomes from patients in the region. Kenny says they have found 17 different introductions to the La Crosse area. Gundersen has sequenced more cases than 36 individual states. Kenny says their research shows the majority of viruses brought to the area stop spreading within a family's home.
When you can see that the virus arrives and doesn't go any farther, I mean, that's really good evidence that the social distancing is working.
That is why health officials are screaming for more testing.
All of us want to get the economy started again, but we definitely don't want to be in a situation where it's 1 step forward and 2 steps back. Not to mind 1 step forward and 5 or 6 steps back.
Reporting in La Crosse, this is Jordan Fremstead, News 8 Now.
In March, the Gundersen-Foundation's medical microbiology research laboratory, developed a test for COVID-19, reducing the wait time for results from days to just hours.